Good day, class. So we are now on our final leg for your immunology course. And I am tasked to deliver the last two topics of your immunology, which is your immunodeficiency diseases, and then you have your cytokines. So for this video lecture, our topic is about immunodeficiency diseases. And the video discussion is actually divided into two. Okay, the first part of this video lecture, I will only cover the deficiencies of your B cell system. And then with the second part of your video lecture, we'll discuss your immunodeficiency diseases that is associated with your cell-mediated, specifically either both of your T cell and your B cell. Okay, and we call that one combined. And I'll try to cover that one on the second video. For this video lecture class, I want you to recall what you learned in your adaptive immune system, specifically the T cell and then the B cell ontogeny. So why do we need to have a good and strong background of your T cell and B cell maturation in dealing with the immune system disorders or diseases? Always take note as we discuss this one in your adaptive immunity, specifically the maturation or ontogeny of your T cell and your B cell, that during that maturation, there are series of checkpoints. Okay? So, for example, negative selection or positive selection. And those checkpoints will try to check and double check if the cell is reactive or non-reactive to a specific uh, autoantigens, because naturally human as we are protein in nature, and protein are antigen. So during the maturation, your B cell and your T cell should not react to our own proteins or own antigens. We call that one autoantigens. Okay, so if the cell, okay, fail to recognize our own antigen class, then we call that one autoantibodies. Okay, so we discussed that one with the previous lecture. Okay, and for the immunodeficiency diseases, okay, the problem, okay, also lies on the maturation. Either there is a lack of enzyme, okay, present during the maturation, leading to, for example, haltment or pag-stop ng isang maturation series, and or mutation by the genes. And we'll try to cover that one. Okay, so again, if you have some questions in or clarification with this video lecture, please consult your corresponding professors. And you can follow my video lecture. 98% okay, of my video lecture content can be found on your book. Okay, so the main purpose why we have this video lecture, which is 98% is coming from the book, is that majority of the concept, okay, found in the book, specifically in the immunodeficiency disease, are very difficult for you to understand. Okay, even like me, or I don't know with other teachers, when introduced with immunodeficiency diseases, and then it's a like a hybrid of cytogenetics, and then also a touch of your hematology, clinical chemistry, and then also with the bacteriology, because that's the end. Okay, so if our immune system is failing, then the bacteria, fungi, viruses will also strike. So that's the main reason why you need to watch this video lecture for you to understand the theory. And I will try my best to explain in a simple way for you to at least understand. Okay, so hopefully that together we can digest this topic, okay, carefully. Okay, so let's start with your immunodeficiency diseases. So if you will try to dissect the term class immunodeficiency diseases, so we can divide that one into three. You know the term already, disease. So it's abnormality, okay? With the manifestation of the patient, for example, fever and or any manifestation. Okay, we call that one with the disease or abnormalities. For the immunodeficiency, we can dissect that one into two. Okay, so you have your deficiency. Okay, ibig sabihin class lacking. Okay, so either it's a complete, okay, absence and or partial absence. So later we will try to discuss that one. So ano yung ibig sabihin ng deficiency? Okay, deficiency of what? Okay, with the immuno. Okay, immuno pertains to your immune system. So either there is a deficient on your immune system component. So either humoral or cellular component. So in this video lecture, since B cell yung dinidiscuss natin, then we know that the B cell will, okay, progress and mature to plasma cells, and plasma cells will release antibodies. Then therefore, your deficiencies of your B cell system is more humoral. Okay? So the immune system, as we know, as we discussed during the first topic of our course, that this is a diverse and complicated network of many biochemical and cellular components. Yeah, we learned that there is a different cell involved in innate, then there is a different cell involved in adaptive. Okay, so however, although they are with the different compartment class. Okay, so they interact with each other, and we have that one with your cytokines, okay, which are their communication molecules. And then if you can observe here, so you have your innate immunity cellular response, and that includes your dendritic cells. You have your phagocytes, and then other immune cells. Okay, and then for your adaptive, of course, you have your B cell and your T cells, and then your B cell will progress to plasma cells, then will release to your antibodies. And then, it says here in your book, if you can observe this one, di ba? Masyadong complicated sa tingnan class. However, this is very simple. Kasi if you have a lymphoid, a stem cell, and then it will either stay to your bone marrow and mature as a B cell. Okay, so start with the B lymphocyte to B lymphocyte to your plasma cells, and then will release antibody. And then there are some lymphoid stem cell that they don't like to stay on the bone marrow. So gusto nilang transfer to another school. Okay? Kasi we call bone marrow and thymus school, okay, or university class. Kasi your bone marrow in your thymus, that's the area of the body where the T cells are educate or will be educated. Okay, so ini-educate yung T cells and B cells kung sino yung autoantigens and or sino yung foreign antigens. Okay? So we call your thymus and your bone marrow universities. So either you will stay to the bone marrow university and specialize producing antibodies, and or you will go to your thymus university where they specialize in supporting kay other cells, specifically with your B cells. Kasi yun naman talaga yung trabaho ng T cells, di ba, class? They either support, that is with your T helper cells, and or they directly kill, that's your T cytotoxic T cells. Okay? So if you can observe here, your thymus will try to educate your lymphocytes, and then your lymphocytes will either produce will either sorry class will either produce your cytotoxic T cells or your helper T cells or your regulatory T cells. And then your T cells, okay, subsets, we call this one subsets. Although in your CD4 class, okay, helper cells, we have different subsets. Pero yung dinidiscuss lang talaga natin is itong tatlo. You have your helper T cells, you have your regulatory T cells, and then you have your cytotoxic T cells. And these subsets of your lymphocytes will influence the maturation of your B cells. So if kung magka-problema si T cell class, magkakaproblema din si B cell. Why? Because your T cell will produce cytokines for the maturation of your B cells. So if kung magkakaroon tayo ng T cell problem, along the way, your B cell will be affected. Okay, so this is why in your book class, okay, immunodeficiency diseases are the components of the immune system that play a unique but overlapping roles in the host defense process. Okay, so ibig sabihin class, your immune system may both activate your innate and your adaptive arms, okay, to or overlap, okay, to kill a certain infectious agent. Then a defect in one arm, ito yung sinasabi ko kanina, a defect in one arm of the system may affect other aspect of your immune function as well. So ano yung sinasabi ni Steven's class? Sinasabi ni Steven, pag nagka-problema daw yung T-cell mo, magkaka-problema din yung B-cell mo. Okay? Because your B-cell requires your T-cell for the maturation, specifically with the release of cytokines. And T-cell subsets, okay, here, if you can observe on the number 3, T-cell subsets each, okay, secrete cytokines, okay, that regulate the development of your B cell into plasma cell. And a defect of your T cell function removes or unbalance the regulatory. So yun yung sinasabi ni Stevens class, na your T cell are very important specifically on the development of your B cell. Then immunodeficiency states are associated with allergic or autoimmune manifestation. That's the reason why nung natapos na tayo sa adaptive immunity, yung ginawa na natin, adaptive immunity, then you have your major histocompatibility complex. That's the end of the basics class. Okay, if you finish those subject or sorry class topic already, then now you are ready for the diseases. And your previous video lecture discussed the autoimmunity, and then you have your hypersensitivity, which are the end product or consequence of your disorders in your T cell and your B cell and T cell maturation series. So, for the immunodeficiency, we call this one primary. Okay, so ibig sabihin ng primary class, it happens on the maturation. Okay, so pag sinabi, mayroon din tayong mga terms class na sinasabing secondary immunodeficiency. However, in your book, Stevens, she did not even like mention the secondary immunodeficiency. However, if you will read other reference book with your immunology class, you can encounter the term secondary immunodeficiency. When you try to differentiate your primary and secondary, your primary immune deficiencies are associated with either genetics class. Okay, so meron tayong affected yung ano natin, genetics natin or genes, either by mutation. Okay? So, several of the most important immunodeficiency syndrome show an X-linked inheritance and thereby affect primary males. And later, if I'll introduce the uh, conditions under your immunodeficiency, you can observe na lahat affected male. Okay? Although meron tayong mga recessive that will also affect your female. Okay? And then rare with a combined incidence of about 2 in 10,000 live births. Okay, so kukonti lang naman yung affected. However, the immunodeficiency can lead to death if not managed. So why do we need to test? Okay, this is the main question, class. Okay, so why do we need to test if the patient is having this type of immunodeficiency condition? So first, of course, is early detection and treatment can help me prevent the development of serious long-term tissue damage or overwhelming sepsis. Then second is early diagnosis. Kung hindi natin sila ma-detect at birth, then pwede natin silang ma-diagnose as early as possible. So more than 120 class. Can you imagine there are more than 120 different congenital forms of immunodeficiency. Pero sir, can we like cover that one in a one whole sitting of a video lecture? Of course not, class. We cannot cover everything. However, I will try to cover those topic that usually lumalabas sa pre-board exam ninyo and or board exam. So you'll be prepared because at the end of the day, you will take your board exam. If you will not take your board exam, you'll become physician. So therefore, at least you have a basic knowledge kung ano yung meron sa mga immunodeficiencies. Okay, and then on this video lecture, I will try to cover the defect of your lymphoid cells. The phagocytic cells, I will try to cover that one on the second part of the video lecture. Pero very short lang din. Okay, and with the complement proteins, okay, I believe that I was able to cover that one slightly in your complement discussion. Okay, so let's move to your deficiencies of your B cell system class. Okay, so we call this one gamma globulinemias. Ayan. So if you can observe on my PowerPoint here, you can observe that there are different colors. Okay, I intended to divide that one to dissect the term. So you have your ibig sabihin ng A class is none, diba? If we can observe in a term with an affix of it means none. And then gamma, okay, so if you can observe, di ba tinuro ko naman to class dati, have this one. So you have your albumin, the highest peak of your SPE, serum protein electrophoresis. Then you have your alpha 1, alpha 2, beta, and then you have your gamma globulins. So the A gamma here class is the gamma region. And then the globulin here class pertains to the protein. Okay? And then you have your emias. Okay, emia, okay, that pertains to your blood. So ibig sabihin class is walang gamma globulin na nakikita sa dugo. Okay? So pag sinabi natin gamma globulins, so those are your antibodies. So you have your game, diba? IgG, IgA, ME, and then you have your IgD. Okay, so ibig sabihin nito class, wala daw gamma region. So if you can observe that one class in a laboratory setting, kasi di ba pag sa laboratory, wala namang kamay, di ba? Pag magpapatest ka. Okay, so yung tinitignan natin is your serum protein electrophoresis. So ganito yung itsura niya class. This one is a control, okay, showing your albumin and then a light band of your alpha, then alpha 2, then you have your beta 1, and then you have your gamma regions. Okay, gamma region class. And then if the patient okay, is having a condition called your gamma globulinemia, then if you can observe here, wala siyang band. Okay, kasi okay, absence of your gamma globulins. Okay, so the mechanisms okay, of the agammaglobulinemia include your genetic defect in the B cell maturation or mutation itself, okay, leading to the defective interaction between your B cell and your T cell. So imagine class, a person that does not have antibody, so it would be very difficult for them, right, to fight against infection. Although your complement is a good opsonin, however, your antibody is the most potent opsonin. Okay? And it actually differs kung ano yung type of infection. Like for example, allergic reaction, then you have your IgE. Diba? Because your mast cells and your basophils has a receptor called your Fc epsilon receptor. Your neutrophil will identify the Fc portion of your gamma or immunoglobulin G. So these are just a few of the examples kung gaano ka-importante si immunoglobulins class. So in your book, table 16-1, hindi si Connie class, si Stevens, okay, mention different defects of your B cell system. And then we will try to discuss your IgA deficiency, your X-linked gamma globinuria, gamma globinemia class, common variable immunodeficiency, isolated IgG subclass deficiency, at saka immunodeficiency with hyper immunoglobulin M. So let's start with the first condition under your defect of your B cell system. And we have your Brutons, okay, agammaglobulinemia, or X-link, okay, Brutons agammaglobulinemia. Okay, so if you can observe here, guys, in the picture, okay, during your B cell maturation, you know this one already. We have your precursor, diba, in your bone marrow. Then you have your pro B cells. Then your pro B cells will mature to pre B cells. Then to your immature B cells, to mature B cells. Then mature B cells, your plasma cells. Then will release your antibodies. So if you can observe in between your pre B cells and pro B cells, merong problema. And we will try to discover, class, kung ano ang problema kay underlying this one. So, Bruton's kay agammaglobulinemia is an X-link kay chromosome, X chromosome link. So, this syndrome affects male almost exclusively. And then patient with the X-linked agammaglobulinemia, they lack, okay, the circulating mature CD19 positive B cells and exhibit a deficiency or lack of immunoglobulin of all classes. Okay, if you will try to recall, class, on your discussion with your B cell ontogeny, this is the B cell ontogeny, class, correct? This is your stromal cells, okay, found in your bone marrow. And then you have your c-kit, right? Okay, that will attach with your lymphoid B cell. Ito, precursor na to, class. Kasi, di ba, floating naman yung mga lymphocyte, yung mga precursor ng lymphocyte. Okay, kung sino yung may affinity kay c-kit, wala silang choice but to stay in the bone marrow. Yung walang affinity kay c-kit, pupunta sila kay thymus. Okay, ganun yung selection nila, class. Okay, tapos with your, this one, if you can observe on the cell surface of your B cell, then you have your CD19. Okay, class here, CD19. Okay, so according to Stevens, okay, page 25 of your book, para may recall lang tayo, okay, you have your CD19 acts as a core receptor that helps to regulate further B cell development and activation. So if there will be no circulating CD19 glass in the surface, so it means na meron tayong problema at the end. Second, with the circulating CD19 class is that your Bruton's condition lacks the enzyme called your BTK or Bruton tyrosine kinase. So in Bruton tyrosine kinase class, it happens here in between, okay, your maturation of your pre-B cell to your immature, class, immature B cell here. And then, the lack of enzyme apparently caused a failure of your heavy chain variable gene rearrangement. Diba? I believe that you also studied carefully, okay, the gene rearrangement of your antibody. And then, during your pre-B cell, okay, from your mu, diba, you have your mu antibodies inside, which is in your cytoplasm. Here floating, sorry, class, in the cytoplasm, and then will express, diba, to your cell surface, and the mu antigen here will serve as your BCR, correct, as we recall. And then this one, the process of this one, class, is aided with your Bruton tyrosine kinase. Yun yung function ni Bruton tyrosine kinase. However, in this condition, class, with the Bruton agammaglobulinemia, is that they don't have your BTK enzyme. So, if kung wala kang BTK enzyme, class, what will happen? Your pre-B cell will not mature, will not proceed to immature B cell. Yan. Okay, so hindi sila magmamature, class. If kung hindi sila magmamature to immature, di ba, pangit ng term. Okay, so pag hindi nag-proceed si pre-B cell to your immature B cell, then therefore, class, there will be no production of your mature B cells, plasma cells, and to your antibodies. That's the reason why they are called gamma globulinemia. Kasi wala talagang na-produce na antibody. Kasi wala namang na-proceed na B cell. Kasi walang BTK na enzyme ang pasyente. Kaya pala, class, when you try to read your book, here, nakalagay, furthermore, they have, class, here, furthermore, they have no plasma cells in their lymphoid tissues, but they do have a pre-B cell in the bone marrow. So, ibig sabihin class, sabi ni Stevens here, meron daw silang pre-B cell in the bone marrow. If you can observe here, bone marrow, there is a pre-B cell in the bone marrow. However, they don't have a mature one. Okay? So, wala silang mature. Okay? So, furthermore, they have no plasma cells in their lymphoid tissue, mature B cells also in the lymphoid tissue. However, when you check your bone marrow, they have pre-B cells. Okay, that's a good indicator that the patient is suffering with the X-linked protons agammaglobulinemia. And then they develop a recurrent bacterial infection, okay, beginning in infancy as maternal antibodies cleared. And then they most commonly develop your sinopulmonary infections caused by your encapsulated organism, such as your streptococci, meningo, okay, cocci, and you have your Haemophilus influenzae. What are the common of this organism class? Okay? Kasi hindi gram-negative or structure or shape ng organism, right? With your streptococci, meningococci, Haemophilus influenzae. The common denominator of this organism is that they are encapsulated. Okay, they contain your capsules. Diba? Aside from your streptococci, meningococci, and Haemophilus influenzae, or pneumonics, for your encapsulated organism is you have your AIMS. Diba? You have your Haemophilus influenzae A, I for your Haemophilus influenzae, sorry class, AIMS. You have your Streptococcus agalactiae, then you have your I for Haemophilus influenzae, then M for your Neisseria meningitidis, and S for your Streptococcus agalactiae. Okay, so those are the most common encapsulated organisms that can cause meningitis. So why our body, if we have Bruton's agammaglobulinemia, bakit nagkakaroon tayo ng exposure of your prone infection of your encapsulated organism? We can answer that one class with the explanation of your lymphoid organs. Diba in your lymphoid organs, we have your uh, lymph nodes as a um, checkpoint. Okay? 'Di ba, madami tayong lymph node sa katawan. That lymph node class will consider as a checkpoint. So, chine-check niya muna class if kung this one is a autoantigen or a foreign antigen. So, paano nila chine-check? So, 'di ba kung in a real life, kung may checkpoint, may mga police, 'di ba, to check if kung may dala-dala ka. Okay? So, pagdating sa katawan class, the police, okay, those police class are your B cells. Okay? So they will check. However, here, if you can observe class in the book again, because okay, of the lack of your B cell, the tonsils, the adenoids, together with your lymph nodes, okay, those are your secondary lymphoid organs, diba? Lack normal germinal center. So, ibig sabihin, class, if you will have your cross-section of your lymph node here on the germinal center, meron tayong B cells. Okay? So, ganito yung itsura class in a normal way. Meron tayong T cell to your dendritic cell, tapos meron tayong presentation of your antigen, tapos dendritic cell to your B cells. These are the loop of your B cells. And then your B cells will go outside and produce your antibodies. Tama? Pero with the Brutons, sa agammaglobulinemia, wala silang B-cell class. 'Di ba? Wala silang mature. So, anong nangyayari pag wala silang mature class? Eto, empty to. 'Di ba? So, every time that we encounter encapsulated organism in your secondary lymphoid organs, walang magpa-process. Okay? Walang mag-opsonize. So, walang kakain sa mga organism. Kaya, we are very prone to that certain organism. Then, for the treatment of your Bruton sa agammaglobulinemia is, of course, administering your intramuscular or okay, venous immunoglobulin preparation. So, alam naman natin ang pasyente, walang antibodies. So, lagyan natin siya ng antibodies. Okay? That's a good thing about your B-cell problem. Pag kulang tayo ng humoral problem, like for example, kulang tayo ng antibodies, then we can give the patient antibodies as a uh, treatment for infection, specifically your bacteria or parasitic infection. Okay? And then, if you can also observe on the book, so how can we differentiate your X-linked agammaglobulinemia from your transient hypo kay gammaglobulinemia of infancy? So, madali lang, class. Okay, with your X-linked agama, okay, so dapat wala siyang CD19. Kasi, 'di ba, yung CD19 makikita sa pag may transient ka. Okay? And then, of course, the persistence. Pag ano, class, nag-persist beyond 2 years old yung ano natin, condition, then we call that one X-linked na baka pwede nating i-check through bone marrow to double check if kung sa bone marrow meron siyang pre-B cell. Pero pagdating sa lymphoid na ano, class, area, wala siyang plasma cells or mature B cells. Then, we'll move to your IgA deficiency. Yan, so madali na lang yung term kasi deficiency, kakulangan ng ano, IgA. Okay, more specific on your IgA. With your IgA deficiency class, okay, we learned in your antibodies that we have 5 antibodies. Okay, you have your GAMED. And then isa doon si IgA. Okay, most patient with the deficiency of IgA are asymptomatic naman sa class. But in a laboratory perspective, okay, you have your test control here. You have your gamma band here. Then you have your alpha. This is your IgA. So wala siyang band class. Then you have your IgM, meron siyang band. Then you have your kappa and lambda. Okay? So as discussed in your previous video lecture, that we have your kappa and your lambda as a basic component of your antibody. And then if we can observe, the kappa band is more thicker compared with the lambda band. Why? Because we learned also before that meron tayong ratio. Tinatawag natin na ratio, di ba? Kappa-lambda ratio class. And then with the kappa-lambda, dapat mas madami si kappa over kay lambda. Okay, so ang ratio natin dyan class is 2:1. Okay, so dapat mas madami si kappa over your lambda. Okay, if the patient is symptomatic in a way, okay, those with symptoms usually have infection of the respiratory and gastrointestinal tract and the increased tendency to immune diseases. Remember the function of your IgA class, secretory sila. So more on the upper and or upper respiratory and or gastrointestinal. Allergic disorders and malignancy are also more common with your IgA deficiency. So the main cause of your IgA deficiency is not well established. However, they hypothesize that the lack of your IgA, okay, is caused by impaired differentiation of your lymphocyte to become your IgA producing plasma cells. It was also discussed in your antibody video lecture that we have your class switching or isotype switching. So from the B cell, di ba, you have your B cell, you have your IgM and your IgG on the surface of your B cell. And then your B cell, you will have your isotype switching either from your IgM to your IgG, IgE, or IgA. However, okay, the problem of your IgA deficiency probably is that failure of your class switching. Yan. Kasi instead of switching from your IgM to IgA, meron siyang failure. Okay, however, in your book, it was not explained the molecular level of the problem underlying your class switching. And second reason, class, aside from the class switching, failure of the class switching from your IgM to your IgA, is 30 to 40% of your patient na merong IgA deficiency class, okay, have anti-IgA antibodies. So these are floating antibodies that will direct your own IgA. Okay, so dapat ito yung IgA mo. Tapos yung katawan mo nagpro-produce din ng IgA. Kaya anti-IgA. Kaya tinawag siyang anti-IgA class. Okay? And these antibodies can cause anaphylactic reaction when blood products containing IgA are transfused. So we need to be careful with this one. So we're done with the two conditions. You have your X-linked amaglobulinemia and you have your IgA deficiency. Okay, so the next is common variable immunodeficiency. These are very short, okay, condition. Okay, with your common variable immunodeficiency, it is characterized by gamma globulinemia that leads to the recurrent bacterial infection. Of course, all of this condition class under your B cell system of immunodeficiency could lead to recurrent bacterial infection. Why? Diba? Why? Correct class. Because the end product of your B cell is plasma cell 2. Your antibodies is humoral. Okay, so that is the main reason why we have your recurrent infection. And take note with the common variable immunodeficiency. Compare with your Brutons na meron tayong A or complete class. Ibig sabihin ng A, ibig sabihin complete cessation of the production of your antibodies. However, in your common variable immunodeficiency, it is only hypo. Ibig sabihin ng hypo class is decrease, okay, production of your immunoglobulin. Okay, there is usually a deficiency of both IgA and IgG, but selective IgG deficiency may also occur. So if you can observe in the picture also, okay, here, this is the normal one, okay, of your immune system. And then having your common variable immunodeficiency and then bacterial infection will occur, causing different infections in the body. So the major problem of your common variable immunodeficiency, meron tayong tatlo class. Okay? So first, either your T cell or their products appear to suppress differentiation of your B cell into plasma cell. Diba? Na-discuss ko kanina that your T cell will always influence your B cell maturation. So ang problem class, hindi B cell ang problem. Ang problem si T cell. Okay, si T cell hindi nagre-release ng specific cytokines for the B cell to mature. Si B cell nag-aantay. Diba? Nag-aantay siya kay T cell. Pero si T cell, hindi siya nagpa-function well. Kasi B cell naapektuhan. Second, either also your T cell produce cytokines, pero those cytokines are suppressing, okay, dematuration and differentiation of your B cells. Okay, second, your T cell may fail to provide adequate help to support terminal differentiation of B cells. Yun pala yung sinabi ko kanina. And third, si B cell talaga yung problema. Diba? So, yung dalawang reasons kasi class, we are considering baka si T cell yung problem. Baka si T cell nag-release ng cytokines that impede or halt the differentiation and maturation of your T cell, your B cell. Second, baka probably your T cell is not producing enough cytokines for the development of your B cell. And third, lastly, baka si B cell talaga ang problema. Yan. Okay? Kaya nagkakaroon tayo ng common variable immunodeficiency. Next, let's move to your isolated IgA subclass deficiency. So from the name itself, isolated, so ano lang siya? Kasi 'di ba when we try to discuss your complement before and your immunoglobulins, we know already that your IgG have subclass. You have your IgG1, IgG2, IgG3, IgG4. Tama? So pag sinabi nating isolated IgG subclass deficiency is isolated lang sa class. Either si IgG1 lang yung wala or wala si IgG2 or wala si IgG3 kasi isolated lang siya. Okay, na IgG subclass deficiency. So most of your IgG antibodies, we have 4, diba? And we need to identify this one class. Okay, in terms of how this immunoglobulin will try to opsonize a specific part of your bacteria. So your IgG1 and your IgG3 subclasses, they are potent if the antigen is a protein in nature. Example, toxins. So if the bacteria produces toxins, then the antibody fit and potent to opsonize that one is either your IgG1 and your IgG3. So pag tinanong naman sa exam class, inter or board exam, kung sino yung mas potent, whether IgG1 and your IgG3, it lies on the number. Your IgG1 is most abundant, which is 70%, compared with your IgG3, which is 6%. So therefore, your IgG1 is the most potent, okay, in opsonizing your toxins, okay, produced by your bacteria. And then we also have your IgG2 or IgG4 subclasses that are very potent if the bacteria antigen is carbohydrate in nature. So example of carbohydrate in nature class, you have your polysaccharide antigens, di ba? Or LPS, lipopolysaccharide, which cause a recurrent infection with E. polysaccharide encapsulated bacteria such as your Streptococcus pneumoniae and Haemophilus influenzae. Okay, so at least now you know that your IgG1, IgG3 are correct, potent for your protein antigen. Then IgG2 and IgG4 for carbohydrate antigen. Okay, so the cause of your isolated IgG subclass deficiency is the heavy chain. Okay, the heavy chain gene deletion and transcriptional defect. Okay, so nagkakaroon daw tayo ng defect, okay, with or deletion of your transcriptional heavy chain. Okay, and then most common subclass deficiency is your IgG4, which is very okay lang. Why? Kasi kung meron tayong IgG4 na deficiency class, if yung IgG4 is 4% lang, diba? So, if wala kang IgG4, your IgG1, your IgG2, and IgG3 can neutralize your protein antigen and your carbohydrate antigen. And then yung least common natin na IgG deficiency is your IgG1, okay, which is a good indicator for us and for the patient kasi we know that the component of your IgG1 is 70%. Then, therefore, a deficiency of a single subclass okay, may not result in a total IgG level below the normal range. Why? Because if there is a mutation or a problem with your IgG4, okay, deficiency, then the number of your IgG subclasses will not be affected kasi 4% lang siya. Unless, kung IgG1 yung affected. However, as mentioned by Stevens, the least common is your IgG1. So, okay tayo. Okay tayo dyan, class. Okay? Now, we are done with your class? Immunodeficiency diseases. Okay, deficiencies of your B cell system. So, if you can observe, very short ang topic. So, I hope that you understand. And then, if you were not able to understand the video lecture class, please revisit again your book, then together with the video lecture. And then if you have some questions and or clarifications, please don't hesitate to contact your professors. And to end this video lecture class, always remember that understanding the consequences of your malfunction ng immune system mo lies always with the basic and fundamentals of your adaptive immunity. So for now, if you think that you have difficulty understanding the diseases, maybe might as well revisit your video lecture with your adaptive immunity, specifically with your T cell and your B cell ontogeny. Okay, so Thank you again for watching this video lectures. I hope that you understand. Bye class. See you on the part 2. Bye class. Thank you. Thank you. And see you in the part 2 of this video lecture.